Hello, Edutainment Studios and Access Healthcare welcome you to Head and Neck Cancer Treatment Guide. This module is part 2 of a 6-part series on head and neck cancer. Head and neck cancer is an umbrella term that refers to cancer that begins in the head or neck region of the body. The types of head and neck cancer are named after the area in which they originate, such as oral cancer, which forms in the oral cavity, and throat cancer, which develops in the throat. Because most head and neck cancers form in the surface layer of the tissue, where the cells are flat and squamous, most head and neck cancers are squamous cell carcinomas. Head and neck cancers account for about 3% of all cancers in the United States. The majority of head and neck cancer patients are over the age of 50. Men are 2 to 3 times more likely to develop the disease than women. In this course, the objective is to help you know, how is head and neck cancer staged? If tests show that you have head and neck cancer, the next step will be to describe your cancer's growth. This is called staging. In this phase of your diagnosis, your doctor will determine where your cancer is located and if it has spread to other parts of your body. There is a different staging system for each type of head and neck cancer, but they are all divided into 5 stages: 0, 1, 2, 3, and 4. The higher the stage, the more likely your cancer is to have grown deeper into your tissue and/or farther away from its original location. But unlike other cancers, a stage 4 head and neck cancer does not necessarily mean it is incurable. When your doctor talks about your stage, they may refer to your cancer as local, locally advanced, or metastatic. If your cancer is local, this means it has not spread. If it is locally advanced, your cancer has spread, but not far from the original site. If it is metastatic, it has spread far from the original site to other parts of your body. One tool that helps to stage head and neck cancer is the TNM system. The TNM system asks questions about your cancer. T stands for tumor, and the question is, how large is the main tumor and where is it? N stands for node, and the question is, has the tumor spread to any lymph nodes? M stands for metastasis, and the question is, has your cancer spread to other parts of your body? Finding out your cancer's grade helps your doctor determine how aggressive your cancer is. The grade tells how similar or not cancer cells look to normal cells. Low grade, also called differentiated or well-differentiated cancer cells look similar to healthy normal cells. High grade, also called undifferentiated or poorly differentiated cancer cells look very different from healthy cells. Your doctor will use some or all of these factors to decide the best treatment for your head and neck cancer. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for part 2 of this 6-part series on head and neck cancer, and come back for part 3.